Welcome back to Medigap Show. I'm your host, Hollie Cohen, and today we have a very special guest, Dr. Shari Rosenbaum, internal medicine doctor. She's going to share with us some views that she has in relationship to Medicare. So before we delve into our discussion about Medicare, and there's been some shakeups lately in the world of Medicare over the last, in my estimation, 3 years. With your extensive background and commitment to personalized healthcare, what have you seen happen? We're going to talk about this, but what have you seen happen in the last 3 years in your practice in relationship to Medicare?
So I don't know if I can limit it to just the past 3 years, but I think it's a slow boil of the disintegration of healthcare system in general. That things definitely took off during since COVID and as big businesses have taken over. But what I think we're seeing is the clock ticking and Medicare dollars dwindling and the healthcare system trying to save or stretch those Medicare dollars as far as possible. So in order to accomplish that, we've seen the evolution of Medicare Advantage programs, which you and I both call Medicare Disadvantage programs, and I'm sure we'll get to more of that. And more recently, accountable care organizations and ACOs. And I think these are both vehicles that have been implemented to save dollars. And while the intentions are good for all comers, we're seeing changes and surprises that are not very welcome to the patient or consumer.
Right. So your practice, does it have a pretty significant amount of seniors over age 65?
So I practice in Florida, where the average age patient in my practice is about 67 or 68 years old per patient, but 85% of my visits are patients that are Medicare age, because that's who utilizes the healthcare system most.
I mean, I go back to, the last couple of years, 3 years, because there has been a lot of advertising and a lot of seniors have switched just simply by watching television and watching an ad and calling the phone number and not even understanding what they had and what they're switching to. So has that happened a lot in your practice?
So it's happened for years now, but more recently, like you're saying, in the last 3 years, it's accelerated. The introduction of Medicare Advantage, it's a misnomer because patients don't understand their hard-earned dollars that they've paid into Medicare all those years they've worked. When they are baited into Medicare Advantage, they feel like they're getting more for their dollar. And what they don't understand and where they're surprised is all of a sudden they're like, well, why did I get a bill for this? Why did I get a bill for that? I have Medicare. I'm like, well, that's your copay. That's your deductible. And then what I find most frustrating for these patients is when they're hospitalized and they need home health care or services after the hospital, they have fewer choices and it's not necessarily the choices or places I would want them to go to.
Right. So, I mean, you have seen a big change. It's like you just said, I mean, there's just a lot of, the commercials have really confused people over the years. So, when your patients did switch, like you just explained, did they know what happened? Did they understand that they lost original rights to their original Medicare?
No, they think it's Medicare. And for years I've been trying to tell them, I'm like, it's not Medicare Advantage is not Medicare.
Do they understand that once they do make that change, and they're in a state such as Florida, where your practice is, that it's very challenging, if not almost impossible many times, to get back to original Medicare with, let's say they had the supplement in place before, Medigap plan. Because that's how this works. If someone's had Medicare Part B for more than 6 months, then they have to go through medical underwriting. If they switch to Medicare Advantage and they've come off, let's say, original Medicare and a Medigap, and they're in their very first year of the Medicare Advantage plan, they can go back to the original Medigap plan that they had, putting them back onto original Medicare within a 12-month period, but only the same company that they used to have. So, I mean, you could definitely share that with your patients who have made that switch if they're looking to get back and if they do have health issues. Because that's the worst part of this is all these seniors who've switched in the last few years. And, you've said you've seen it. I mean, I've been in this business a long time. I've seen it too. It's not fun to hear and see, but, they just don't always realize that they can't get back to what they had if they wait past that 1 year period. I mean, there's really strict enrollment periods about these things. So if someone has, COPD or congestive heart failure, or, you name it regarding heart, lungs, kidneys, they can't go through underwriting and pass. So it's just confusing. I mean, every day we get phone calls in my office and people don't know what has happened to them and they can't get in to see their doctor because their doctor's out of network and some agent in a call center trying to win a bonus, seriously, that's what goes on. They don't even know what they switched to. They don't understand why their doctors can't see them, won't accept their insurance. Does that ever happen in your practice, or has it happened?
Insurance, once you put the word Medicare in there, everything becomes very nebulous. Nobody knows what anything is. We as doctors barely know, so this is where I learn from you, and I always ask you questions, or I refer patients to you to help them navigate what's best for them. So do patients know that they can, switch back, that they have a limited, window of opportunity? I don't know. I don't know if anybody ever tells them, because of course the person who sells it to them doesn't want them to switch back. But there's Medicare Advantage it's good for some people, right? It does. There's the population that it's good for. Number one, if you can't afford Medicare with the supplemental, then if you have no choice, then yes, then it's good for you. And if you're really healthy and think you're never going to get sick and you come from this genetic lineage of, pure luck, then maybe that's for you. But, insurance is insurance. It's insurance. It's for that rainy day, for that, that healthcare scare that you never expect to happen. And when you do get sick, you want the best care possible. And, the best care possible these days is often filtering into academic medical centers, maybe outside of communities. And, you want to have the opportunity to go to those places. And if you have Medicare Advantage, that may be out of network and unreachable and unaffordable.
You had an extensive career as a doctor and very highly respected doctor in our area. The trouble I find a lot of times also writing a Medicare Advantage policy is not only the networks, mainly the networks, but when someone does have a major health condition, there are very high max out-of-pockets. There's also prior authorizations. Even this year in January, are you still having issues with prior authorizations?
I probably spend an extra hour each day at the end of my day doing prior authorizations for patients. And it's not something I can just hand off to my staff. There's specific wording. If I really want to succeed in getting something approved and authorized, I'm going to take the time to do it myself. But also, patients, they need a CAT scan. My goal is to keep everybody out of the emergency room and out of the hospital. So you need stat scans, but that doesn't happen anymore. You need prior auth. They're like, oh, you know what? Your stat scan will be done in a week, and I'm like, I'm sorry, you're going to have to go to the emergency room because your insurance doesn't cover it. And then we used to be able to do cash pay. People could have, elect to pay. Well, I'll just pay out of pocket, for the scan. And more I'm finding that there's no cash pay options. And I don't know if that's because there are limitations for these facilities that are accepting insurance or not. So those options are running out as well. So people are being filtered into a more expensive healthcare setting, which sort of defeats the whole purpose. And I just can't wrap my head around it.
I want to thank you today, Dr. Shari Rosenbaum, for joining us on MediGap Show. I look forward to having you back whenever you want to come back on.